So I'm going to start off this week actually talking about the Niagara Trends and then go a little bit in more detail about the Ontario Trends overall. So the trend continues here in Niagara with our cases coming down, which is exactly what we want to see. We're getting close to where we were between these, the low point of between the second and third waves, and even back to where we were in the fall. So over the next couple of weeks, by the time we get to the beginning of the reopening in Ontario, hopefully we'll be down at that level, which will be a level where we'll be able to do really detailed contact tracing and hopefully suppress any cases rising back up because of that. I've shown a reproductive number in past weeks, and we can see we're still holding steady around that 0.8 or so level. So things will continue to steadily decrease at that level. One thing I haven't talked about a lot in past weeks has been our percent positivity, and that's something I've been paying attention to. And I'm just going to put up this map that we produce, which shows, the percent positivity levels across Niagara. And we've kind of color-coded according to the color codes in the previous Ontario framework for reopening to show around where those percent positivity levels would be. And one thing I'm very much noticing is that our percent positivity numbers remain pretty high, even though our cases have been coming down. And when I take a bit of a closer look here, and I look at how many tests are being done, and this is looking at how many tests Niagara Health reports that they're conducting every day, I think there's a bit of an interesting pattern here where we can see that the number of tests Niagara Health is doing per day have come down, which makes sense. If there's fewer people who are getting sick, there'd be fewer tests. But now it's actually at a pretty low point, probably the lowest it's been in almost a year in terms of the tests they've been doing. It's below where we were through October, November, where our cases were actually a little lower than where they are right now, lower than the number of tests we are doing in the middle of the summer when our cases are very low. And this is worrying me that people are perhaps not getting tested as much anymore. That's going to be really important that people who have any kind of mild symptom of illness get tested so we can make sure we find every case of COVID-19 and do our detailed contact tracing to make sure we isolate anybody who could be spreading infection. If we're not testing people as much, contact tracing is not going to be as an effective a tool at limiting the spread of infection. And that's going to put us at greater risk that we're not going to be able to keep cases low. So a key message I really want to emphasize to the public is the importance that we're once again making sure to pay attention to our health, pay attention to if we have any symptoms of illness, and making sure we're getting tested so we can make sure we have the contact tracing in place to keep cases low. Looking at the data on variants on our website, you'll probably have noticed that the P1 variant has risen quite a bit in the last week. I think we're at 2 last week, and we've come up to about 7 now. What we're seeing is, for a while, we've seen that on the screening test the province does, they're able to identify that a case is a P1 or the B1617 variant, but can't really distinguish it. And eventually, over many weeks, they're able to sequence some of those and actually differentiate that into there. And so this number is actually around 88 of these had been identified on sequencing. My belief all along has been most of these have been the P1 variant, since that one is the majority in spreading throughout Canada as compared to the B1617. And I think what we've seen is just several of these have now been sequenced and they've moved into this column, but this number has stayed fairly similar around 90. It is definitely a concern, though, that we do have this variant around because we know this variant is associated with more severe illness. The one other one I just want to highlight here is the B1617 variant, which is not actually one of the variants that's identified with any of the screening. So we're able to identify the B117 on screening. We can differentiate if it's B1 or B1351 on screening, but not which of those two. And then there's other variants we're able to identify on screening. The B1617, right now, Ontario does not have a screening test to identify that. And so I'll come back to this point a bit later, but there's a reason to believe that perhaps this is right now a bit of an undercount. Just moving on quickly to take a look at what's happening with our hospitalizations. And we can see our hospitalizations here in Niagara are very much trending down. It's a bit of a flatter trend with maybe just a little bit of a decrease with ICU occupancy. And this is usually expected because people who are severe enough to be in the ICU tend to take longer to get better. This is also where Niagara Health continues to have a few patients that they're accepting from the GTA to relieve the pressure on the GTA hospitals, which still continue to have lots of people in their ICUs and don't have more room to take more. And now switching over to the Ontario case trend, and the case trend is looking pretty similar, with cases coming down in the province as a whole. We're averaging just over 1,000 cases. We actually dipped under 1,000 cases today in the province, which is good news, and hopefully we'll be able to continue to see that come down over the next couple of weeks until we reopen. I noted last week that we've seen the reproductive number province-wide really come down here, and we can see that trend actually has been continuing. And I believe that's because of the vaccine over the last few weeks have been really prioritized in the hotspots in the GTA where most cases were. And what we're seeing now is really the impact of that helping to drive cases down and really drive that reproductive number down. So that's, I think, really good news that that's continuing. And that hopefully means that we'll get cases down in the province quite low before we head towards reopening. Taking a look at the hospitalizations in the province, we can see those are nicely coming down, and we're getting pretty close to where we were between the second and third wave in terms of people in the hospital. Like in Niagara, the ICU occupancy is coming down a bit slower. These patients unfortunately take longer to recover, and we still remain quite high, higher than we were even at the peak of the second wave in terms of people in the ICU. What the provincial modeling by the science table is showing is that we're going to trend down for a while. We would be, according to them, probably around 550 people in ICU at this point based on the modeling. Unfortunately, we seem to be still closer to around 600. So we're not quite coming down quite as quickly as the modeling had predicted. With cases, though, I think we're pretty close. We're averaging just over 1,000 cases a day, which is right where we should be. And as you can see, the modeling says that we could get down to close to 500 cases a day around the time that we maybe reopen in mid-January. Mid-June, sorry. Now, one thing I do want to highlight is that this modeling talks here that it didn't consider new VOCs being considered. And I do want to have a bit of discussion about the B1617 variant, because that is really the new variant that is emerging on the scene. And I think there's some warning signs for us with what we're seeing with that variant. Now, you may remember a couple months ago, I'd often put up this chart here, which is showing what we would expect with the B117 variant. And the thinking was the B117 variant would be slowly growing over time. All the non-variant cases would be coming down. And for a while, it looked like our cases were coming down, then our cases would flatten out, but eventually, as the variant really took over, we would see our cases starting to come up. And of course, that's exactly what we saw play out. The variants were rising over time. These orange sort of lines were decreasing in size as the non-variant cases came down. Our cases looked like they're coming down, they flattened out, and then eventually they started to rise. And of course, we ended up with our third wave as a result. And I've been looking at what the UK is experiencing. The UK, similar to us, has the B117 variant as their overwhelming majority of cases, almost 100% of their cases at a time, were the B117 variant. And that makes sense, of course, that variant emerged in the UK. But they have lots of links and travel with India. And so they've seen the B1617 variant from India really introduce itself there. And they actually have capability to do a lot of very detailed sequencing on what are the different variants going around in their society. And this is kind of what they are looking at. So you can see the P1 variant, this orange line, it's been increasing a little bit. The B1351 variant, the blue line, that's been increasing. And there's all these other variants you can see that are kind of in the same range in terms of how they've been growing. But one that seems to be really rising much more quickly is this one, which is that B1617.2 variant, the variant from India. And so that variant does seem to spread even more easily than our current variants. And that means that it has potential to perhaps take over, similar to what the B117 variant did earlier. And if we're looking at what's happening in the UK here, this is them breaking down over time what is the proportion of the different variants they have. So, this goes up to 100%. This pink color is that B117 variant, and you can see that, through February, March, almost 100% of their variants were that pink color. There's only a small contribution of other variants there. what we can see really since the end of March is that this purple color has been rising. And then the UK reopened around April 18th, and probably about a week, 10 days after that, you have this inflection point where this purple line starts to go up even more quickly. And this is that B1617.2 variant, the variant from India, which looks like it is very quickly growing. It is now over 50% of the cases they're experiencing in the UK. And so it looks like this variant, because it's spreading more easily, is really taking over and starting to replace the B117 variant. And as of course, it's replacing it because it spreads more easily, so it's going to be more difficult to control. And if we take a look at what's happening with the UK's case numbers, they had a big lockdown to get past their third wave. They brought their cases down. They've reopened, and things are going down. They flattened out. And you can see maybe over the last few days, their cases have started to go up again. And that's exactly the pattern that I used to talk about 2 months ago that we were worried about seeing here, where cases would look like they're coming down, flattening out, and then starting to go up because a variant under, below the surface was starting to climb. And unfortunately, that seems to be what the UK is now seeing. And just to show you that this isn't, just what we'd expect in any country that might get cases relatively low, I'm going to draw in Israel here, which similarly brought its cases down, but doesn't have those links with India. So it doesn't have the introduction of that variant from India. And they've seen their cases continue to go down and have come down to an extremely low level as a result. That's unfortunately not what the UK is experiencing. If we take a look at some of the regions within the UK, it becomes even more apparent. And I'll take the region of Bolton here just as the one that's most drastic, where they're seeing their other cases continue to come down, but the B161 variant is really taking off here. And you can see that that's occurring in a few different parts of the UK here. And actually all parts are seeing at least a little bit of increase of that B1617 variant. And then when you add on those usual variants in the kind of beige color to the B1617 variant, you kind of get that complete pattern here where you're seeing increases really in most areas of the UK with that variant driving, unfortunately, cases up. So unfortunately, very similar to that trend that we just saw with the third wave. And the UK is maybe starting to see that occurring with a potential new increase in cases occurring there. Just to look at hospitalizations here, and this is using kind of broader regions, but the Northwest was where we're seeing places like Bolton and Kirklees and a few of those other areas where we're seeing the increases I just showed you. And you can see hospitalizations are starting to trend up there again. The Midlands, where we saw some of those other places like Blackburn on that previous slide, again, they're seeing their hospitalizations starting to trend up. And that's probably, again, that B1617 variant is really putting them at risk. And so that's something I'm paying attention to, because often what's occurring in the UK eventually comes over to Ontario maybe a month or two later. And this is perhaps a warning cloud on the horizon for us. Taking a look at the variant trend here in Ontario, these are, looking at all the cases in Ontario where blue represents variants, yellow represented non-variants, and then green were cases where they just hadn't tested. And you can see over time through February and March, the variants really took over. That orange line became smaller and smaller and is quite small now. And most of our cases are a variant that's blue. And this line here shows what percentage of our cases were variants. And you can see it went up and up and up, went up, well over 90%. But you can see it's dropped down a little bit over the last few days. And, just to kind of zoom in on what that trend looks like here, about 94% of cases were variants. And that has been dropping over the course of the month of May, and it's now close to around 88%. So, one potential explanation is that somehow the non-variants are starting to grow again as compared to the variants. That doesn't make a lot of sense because the variants spread more easily than the non-variants. What I think is actually happening here is that, as I talked about, we don't have a screening test for the B1617 variant in Ontario. So we're a little bit blind to what's happening with it. And I think it is growing. It's not being picked up as a variant because we can't screen for it. And it is the reason that we're seeing the other variants coming down, because it's starting to replace those variants because it is taking over a greater proportion of cases here. And if we actually take a look at some of what we have in terms of the B1617 variant, back in March, of about 3,000 cases that the province was able to sequence, 0.4 were the B1617 variant. In April, that rose to 2.6%. In May, we don't have all the results back, only about a third of the 3,000 or so they're sequencing. But of the third that they've done, it's up to 6.4%. So it very much does unfortunately appear that the B1617 variant is growing. And when we see the variants that were detected going down, it's because we're probably not picking up the B1617 variant because we don't have a screening test. And that's actually on the growth here in Niagara. Now, we're looking at maybe 6-7% of cases that are that, as compared to the UK, which is around 50. So we've got a good 6 weeks before in the kind of situation the UK is in. But I think we need to be very focused on that and paying attention to that to make sure we are able to prepare for and respond to that before we end up seeing any sort of repeat of what we saw with the third wave with that variant taking over. Just to show you a couple other graphs here that's kind of showing the same thing. This is looking at the reproductive number, and this is looking at variant cases. And we can see that with the lockdown, we've pushed that number below 1, and we're keeping variants under 1, which is why we're getting on top of our current wave. But if we look at everything else that's not being identified as a variant, including the B1617 cases, which we are not able to detect, we can see that the reproductive number for that is now increased above 1, which means it is starting to take over and replace cases. And we can see that it's probably about 1.2, which means it's about 20% more, or 30% actually more difficult to control than the B117 variant. And that means as we start to reopen, we're going to potentially have a risk that we're going to allow this number to get even higher and potentially see those cases taking off further. Just taking a look here at Niagara in a similar fashion of what was happening with how many cases have been detected to be variants, you can see we were pretty close to 100% of our cases were variants. Last week or so, we've seen that number drop off quite sharply. Could be the B1617 variant. I'm also wondering, just given the sample size is a bit smaller, then maybe there's a bit of a reporting delay. So we'll need to pay attention to how this changes over the next week. But there is a worrying sign that maybe the B1617 variant is starting to pick up here in Niagara as well. And so how do we make sure we don't let this spike here in Niagara and in Ontario? I think, as we go through the reopening here in Ontario, the first thing, as the province has talked about, they would plan for a reopening to start, in the middle of June or week of June 14th. And I think that's absolutely the right decision. We have the stay-at-home order expiring this week on June 2nd, and the province hasn't been really clear what happens between June 2nd and the week of June 14th. And I think given what we're seeing with that B1617 variant, I would say let's extend that stay-at-home order to the middle of June when we start to reopen to make sure we drive cases as low as possible. So we have contact tracing, best place to make sure we try and suppress any kind of spread of that variant. The second thing that I think we need to do is that, we should go ahead with the first step of reopening because cases will be low enough, but we need to be very careful about then taking that next step into step 2. After those 21 days, we need to be very sure that all the metrics look the right way, that we're not seeing any signs that cases might be rising, hospitalizations might be getting worse before we take that next step. And I would, caution that we might want to even delay a little bit more than 21 days just to be absolutely sure before we take that step. Because if we take that step prematurely and we give him more advantage to that B1617 variant to climb, we could be seeing ourselves heading for a repeat of what we just saw through the month of March when we allowed the B117 variant to take off and drive us into another wave. While we're waiting to move into the framework, I think it's really important we keep practicing all of those important measures that limit the spread of infection. The Ontario Science Table has advised that we need to always be practicing 2 out of the 3 of being outdoors, keeping distance, or wearing masks. And so we want to make sure we keep up with that. And also we want to make sure we avoid crowding places, we don't carpool and be in close contact with others when we're going about stuff. We're not traveling between different parts of the province, and potentially spreading infection as a result. All of these things I think are really important for us to practice over the next couple of weeks before we get into reopening to make sure we don't give any more chance for this variant to take off. The other thing that's going to really be important, I think, for controlling this variant is going to be vaccination. And there's some good news here that when we look at the United Kingdom, when the UK is looking at their cases rising, they're seeing that the 60-year-olds here, cases are really not rising much in them. It's in younger age groups where it's rising. And that's, compare if you look at their third wave here, how high cases were in the elderly, and it's not coming up. And that's, I think, a testament to the vaccine is keeping cases down because they, like us, vaccinated their elderly first and then moved on to vaccinating younger populations. And those elderly who've been vaccinated seem to not be affected by this rise in the B1617 variant nearly as much. And so that's really good news. That means vaccine is going to potentially be the way we're able to control our way through this, B1617 threat. The real world evidence on vaccine effectiveness in the UK does give us one caution, though, that if you have one dose of vaccine, the vaccine is only about 1/3 effective. Once you add that second dose, you start to get much better effectiveness, especially with the Pfizer vaccine, which is close to 90%, and we'd expect the Moderna vaccine to be similar. And the UK scientists actually think that the 60% is a bit low. There's reasons of how their study was done that they think it's actually probably higher, even with the AstraZeneca vaccine. But the key message here is that we're going to need to make sure we get 2 doses of vaccine to everybody to make sure that we're well protected from that B1617 variant. And so if we are cautious about our reopening, we don't allow cases of B1617 to grow too quickly, and we use that time to make sure we're able to roll out vaccine to everybody else who hasn't gotten it, and then get everybody that second dose, that's, I think, going to be our ingredient to avoid any kind of wave resulting from the B1617 variant. And, one good thing that I think we are seeing, is that we're definitely seeing high uptake of vaccinations here in Niagara. Our elderly who've been gotten the vaccine first have really got to really high numbers. We're now over 90% in some of those most elderly age groups who are now also eligible for their second dose. We still have more progress to do with some of these younger age groups to get them vaccinated. When you take a look at who's booked into a clinic through the provincial booking tool, we can actually see that, quite a few of them are still booked in, but we have still more room to encourage this group to sign up to get vaccinated. Now, we can't see people who are getting vaccinated in pharmacies or primary care, so these numbers are hopefully a little bit better, but nonetheless, I think there's still more work for us to do to make sure we get this group vaccinated. Overall, you can see we're at a 55% of Niagara residents are vaccinated. We're pushing 64% of all Niagara adults are vaccinated as well. And overall, when I take a look at Canada and its vaccine coverage, this is taking a look at first doses of vaccination. We can see, we've been steadily increasing the number of people who've gotten a first dose of vaccine in Canada. When we take a look at some of the countries that are ahead of us in rolling out vaccination, we can see we continue to seem to do better. We've overtaken the US in terms of people who've gotten a first dose of vaccine. So we're getting a broader portion of our population covered with vaccine, which means we're going to be able to control COVID-19 more effectively. Even looking at a country like the UK, we seem to be on the verge of maybe overtaking the UK in terms of rolling out vaccines and getting a good proportion of our population vaccinated. And even looking at Israel, which is the world leader one of the world leaders, I should say, in terms of getting vaccine rolled out, they really seem to have plateaued with vaccines a little over 60%. We have the opportunity to perhaps overtake that. And if we get even broader coverage of vaccines than the rest of the world, so a greater proportion of our population is vaccinated, that's going to give us even more protection against the B1617 variant and potentially new variants that emerge elsewhere in the world. But of course, we need to first continue on our efforts to get our coverage that high with that first dose, and then get all of these people back to get that second dose, because as I've shown, that second dose is going to be really critical going forward. And so that I'll stop and turn it over to questions. And I know our partners in the who have television news asked that I maybe come off of sharing the slides. So I'm not going to refer back to my slides as much today with questions, so that they can get some perhaps better footage for their broadcast. So over to you, Courtney.
Perfect. So first questions is Paul. Should be able to unmute now.
Can you hear me?
Yep.
Oh, thank you. Oh, so Dr. Hergy, those numbers are a little bit startling with the B1617 variant, showing, I think, after one dose, only something like 33% effective, and then as high as 60 something percent. I can't see it for the second dose. So does that drive home the point I think you're trying to make, that we really need to get 2 needles in people's arms as quickly as possible?
Yeah, well, absolutely. I'd say first we need to get everybody to get 1 dose of vaccine as quickly as possible. So those people who have not yet signed up for their first dose really should sign up as soon as possible. And then we need to quickly get those second doses back out to everybody else. I think we're in a relatively good position to do that. We have pretty decent quantities of vaccine coming in now. We've got vaccines back into pharmacies and primary care, so they're able to help out with vaccinations. We need to continue pushing that message, because I think if we don't get vaccines out to everybody, we could potentially actually end up with maybe a bit of a 4th wave, which is the last thing anybody wants.
And follow up?
Yes, the other thing is the ICU numbers. You mentioned that even with a mid-June beginning of reopening, we could still be at, I think you said possibly the modeling is 500 or so people in ICU, which is far above the danger zone of 150. So does that show that even at mid-June, we will be at a very fragile stage?
Yeah, the modeling showed that we'd be close to about 550 now. I think once we reopen, we'll be close to about 450 to 500 is what the modeling shows. But as you say, that's much higher than that warning threshold the province used to have of 150 people in the ICUs. We aren't going to be completely out of the woods. We'll be in a fragile state, as you said. Cases will have come down, hospitalizations will come down quite a bit, but we won't have fully recovered our ICUs. And we're not going to have a lot of room for error, both because if we allow cases to start rising, we're going to see people starting to go back into hospitals and back into ICUs, but also we're going to give an opportunity for that B1617 variant to really start to take off. And so, I think we will be able to start reopening in mid-June. We just need to be very cautious and careful as we proceed to that reopening to make sure we don't make a mistake similar to what happened in February and March when we allowed a 3rd wave to happen.
Okay, thank you. Next up, we have Richard. You should be able to unmute now.
Buddy, just wondering if you have a sense of in Niagara, how many of the 80 plus have received their second vaccine so far?
Yeah, just under 20% of our 80 plus group has received a second vaccination. I can also say that looking at our booking data this morning, it looks like probably on the order of 2,000 to 3,000 of that group, which is about 25 or 27,000 total, booked an earlier second dose appointment into the 2nd week of June. So I do think that number is going to continue to go up relatively fast. We saw with the initial round of vaccination, this group was hot off the mark to sign up for appointments, and they seem to be quickly trying to book themselves into earlier second dose appointments.
Awesome. So do you have a percentage of how many people are also booked for it? And is public health or Niagara Health or anyone going in and doing these vaccines in the long-term care homes?
Yeah, so actually long-term care homes, second doses, we actually did that in the late February and early March. So long-term care home residents overwhelmingly already have their second doses. It would only be individuals who maybe initially declined to be vaccinated and have changed their mind more recently, or new admissions to long-term care homes where there might be a few people who still need to get a first dose or maybe a second dose. Overwhelmingly, long-term care home residents are already vaccinated. In terms of the 80 plus population who's booked in for a vaccine, I don't have an accurate percentage for you right now. I would imagine, we've got about 20% of them vaccinated. I'd say it's probably at least another 10 to 15% though who have booked themselves for an earlier second dose appointment. Everybody actually automatically got a second dose appointment when they initially signed up, so everybody does have an appointment coming up. But in the next couple of weeks, probably we're going to see that another 10 to 15% of them get their dose.
Okay, sorry. Just one more thing, if possible. Is that 20% statistic? That's including the long-term care homes then?
Yes, correct. That's including the long-term care homes.
Okay, and how much of that? Sorry.
If we come back to that question.
Yeah, sure.
Okay, thanks. So next up we have Penny. You should be able to unmute now.
Okay, thank you. Going along with the vaccination questions, I'm wondering, Dr. Hergy, if you could give us an estimate, not an exact number, but an estimate. You've talked before about capacity in Niagara, how many vaccinations a day now, especially that we've got physicians and pharmacies back on track, and whether we have enough vaccine to reach our capacity?
I wouldn't say that we have enough vaccine to reach our capacity yet. I would estimate that we probably have enough vaccine to be doing around maybe 5,500, maybe getting closer to 6,000 doses on certain days. But that's, I think, as far as we can go. I think, we could potentially do up to 10,000 doses a day if there was enough vaccine coming into Niagara. And unfortunately, there's just not that much vaccine coming into the province. I think there's a little bit more capacity in Niagara Health to, run their clinics at full capacity 7 days a week. We have a little bit more capacity to run 7 days a week. Pharmacies have quite a bit more capacity, and we have more capacity within primary care as well, with only about a third of our primary care providers able to deliver vaccine right now. Not enough vaccine to go around yet.
Thank you.
And a follow-up?
No, that's good, thanks.
Thanks. Okay, so next up we have Lisa. You should be able to unmute now.
Thank you so much for sharing or stopping the screen share. That's so helpful for us, Dr. Hirji. I'm sorry I didn't bring it up earlier. My questions were also around the second doses of the vaccine. So you've already answered a lot of it, but I might just probe a little bit further. Frontline healthcare workers, I think, are also due for second doses or are eligible for second doses. I'm wondering if that 20% covers that group, and whether people are having trouble booking their second dose. I'm seeing in Hamilton, people are having trouble getting access to an appointment to move up their second dose. So that would be my first question.
Yeah, so healthcare providers, the highest risk healthcare providers, people who work in ICUs, in long-term care, in emergency departments, people who are liable to actually treat a COVID-19 case, they were prioritized to actually get their second dose a few weeks ago, so they were eligible to start receiving it. I don't think that 20% we talked about would include them, just because that 20% is people 80 years of age and older. And I think there's extremely few healthcare providers who would be of that age and still working. So likely that 20% is not including any of those. But we see across most of our other age groups, it's on the order of 4 to 5% of people have already gotten their second dose. And I think the healthcare providers are a big part of that 4 to 5% we're seeing across other age groups. In terms of being able to book a second dose appointment, I have not heard anything in Niagara about people struggling to get that earlier booking. There aren't that many spots for vaccination available still, so that could potentially be something that people run into in the next little while. As of this morning, we still had a few thousand spots in the middle of June for people to book into, but as those get filled up, it's quite possible then people won't have an opportunity to book into an earlier appointment.
So the other problem that we've seen just in emails is people who got Moderna as a first dose aren't able to find Moderna for a second dose. Is that something that you've encountered, and how would you deal with that problem?
Yeah, that's not a problem that we've encountered. It is a real concern, though, of course, that you need to find a clinic where you have Moderna. What we're doing in Niagara is that we're bringing both Pfizer and Moderna to all of our clinics so that we have the option in case someone needs to get Moderna at any clinic. It does unfortunately add quite a bit of operational complexity to actually be managing 2 different vaccines and making sure we're getting the right vaccine to the right person. But it's something that we decided that we needed to do, just given that it would be very difficult for people to figure out which clinic to go to otherwise. So it's, I think people can book into any clinic in Niagara that's run by public health, and they should be safe to be able to get Moderna. The caution would be if they got vaccinated at the Seymour Hanna Clinic run by Niagara Health, those clinics are only Pfizer. And so if they got Moderna, they should make sure they book into a clinic run by public health.
Thanks very much.
Okay, and next we have Bill. You should be able to unmute now.
You muted yourself again, Bill.
There we go. That should work. We've been able to fill all the appointments that we have. We have these clinics. How are they filling up?
Yeah, we find the clinics generally fill up probably, about a week or so before we hit that date, they become full. When we're more than a week out, it seems like people are slow to book into those clinics. And my guess is maybe people are trying to hold out and see if they can get into a pharmacy or their primary care provider to be vaccinated before then. But then as we get closer to that date, people start to fill up those dates.
And the follow-up question is about mixing and matching vaccines. Do you anticipate that that's something that will happen in Niagara? What's the information you have on that, where you start with AstraZeneca and then end up with a different one of the MR ones?
Yeah, I think we're waiting for the National Advisory Committee on Immunizations to give their recommendation of if it's safe and effective to go about doing that and how best to go about doing that. We really want to see their expert opinion on this. I believe what they are partly waiting for is some study in the United Kingdom where they're actually testing out the mixing and matching of AstraZeneca with Pfizer vaccine to really see the results of that. Right now, people in Niagara who got AstraZeneca aren't near the 16 weeks where they'd be due for their second dose yet. So they still have a ways yet. So there's no need to be rushing. Prior to that, though, if someone does feel comfortable getting the AstraZeneca vaccine, they'll have an opportunity 12 weeks after their first dose to go back to wherever they got their first dose to get that second dose of vaccine. And just to highlight again that the clotting issue, which is I think the big concern people might have with AstraZeneca vaccine, is about 20 times less likely to occur on the second dose than compared to the first dose. So it's generally considered pretty safe to get that second dose. But if people are not comfortable, obviously hold off, and we'll hopefully have guidance on what can be done about getting a different vaccine for the second dose.
Thank you. So I think we've gone through everybody once. So if anybody has any additional questions, if you want to let me know in the chat, and I'll let you unmute. Don't know if, Richard, you had additional questions? Okay, I'm not seeing anything. So I think that will be all for today. If you have any further follow-up questions, oh, there we have Bill. Should be able to unmute now, Bill.
Just one question. We've got a new provincial medical officer of health, Kieran Moore, I think. Do you know him? Do you have any thoughts about switching that position in the middle of a pandemic?
Yeah, I certainly know Kieran Moore. He, has been the medical officer of health in Kingston, Frontenac, Lennox, and Addington for a bit over 3 years, I believe. And prior to that was an associate medical officer of health. So I've certainly met him at several provincial meetings, had discussions with him from time to time. I wouldn't say I have a very close relationship with him. He's not one of the medical officers of health I talk to very frequently, just given that he's not in our geographic part of the province. It's very nice that we got someone who is Ontario-based, who understands the Ontario system, who knows the players in Ontario to be the new chief medical officer of health. I think that'll be really good for having some continuity as we take over and not having someone coming in, trying to learn the new system, trying to get to know all kinds of new people. So I think that was really positive. It's probably never ideal that when you're in the middle of a pandemic or an emergency that you're going to change a key person midstream. But Dr. Williams had announced his retirement several months ago. His appointment actually was ending in February, and he agreed to stay on a little bit longer so they could do a proper recruitment to find a replacement. And obviously now they found that. And so he's able to, I think, move on towards his retirement. Fortunate that we're going to have that change, but I think we'll be in probably pretty good hands with Dr. Moore.
Okay, and one more question from Penny. You should be able to unmute now.
Thank you. I hope I can make this question make sense. It makes sense in my head. But so, Dr. Hirchi, you talked about the pharmacies and primary care physicians who were giving AstraZeneca for their first dose didn't start soon enough in Niagara for it to be time for them to be giving those second doses, and they don't have AstraZeneca to do that. They're getting Pfizer now and Moderna. Are they supposed to be focusing now on first doses? Because the booking system is a little bit different, isn't it, between pharmacies and the provincial online booking system for clinics. So I guess what I'm trying to ask is, if I had Pfizer for a first dose and I wanted my second dose, can a pharmacy give it to me, or a primary care?
Yes, a primary care provider or pharmacy could give you your second dose. Now, if it was Pfizer, primary care is not receiving Pfizer, so they wouldn't be able to do it, but
Okay.
a pharmacy that has Pfizer would be, or if you had Moderna, certainly primary care or pharmacy would be able to give that to you. The key thing is you'd need to be within one of the groups that's eligible to get a second dose earlier, or you have to be 16 weeks after your first dose. So right now, that would largely mean that you need to be in the 80+ population for the pharmacy to be able to give you the second dose. But definitely you can switch providers of where you get your second dose as compared to your first dose.
Okay, thank you.
And one more question from Bill. You should be able to unmute now.
Just, I wanted a little bit of explanation. I didn't quite understand. So with this B1617 variant, the one from India, we don't find it on screening in Niagara. We don't have a screening test, but we know it's here. How do we know it's here when we can't screen for it? I missed that. You
Yeah.
may have explained
So,
it. It
yeah.
went over my head.
For sure. So the provinces developed some screening tests which help to identify what different variants are. And the idea is that any sample that tests positive for COVID-19, the province is then testing that sample against those screening tests to figure out, is this a variant or not, so they can get a sense of what the variants are. A small subset of those samples are then also sent for full sequencing. And the sequencing is really the definitive diagnosis of whether or not it's a certain variant or not. A sequencing result is about, I think, a 6-day process to run through the machines. And the province only has the capacity to do a few thousand of those tests a month. So they're not able to sequence every single case. So we're relying on the sequencing to really have a sense of what's going on for the most part. And then the sequencing is really kind of the confirmation. Right now, the screening test can identify the B1617 variant. It can identify if it's the P1 or B1351 variant, can't distinguish between the two, but the screening can say it's one of those. It also has the ability to identify that there's a certain mutation that's not one of these variants, but it has one of those mutations. But right now, there's no screening test that lets us pick up the B1617 variant early. So we really rely on that small number of tests that goes on for sequencing to be able to figure out what's happening with B1617. I think the province is working on developing a sequencing test so that they can start to get a better eye on it. But right now, we're a little bit blind to exactly what's happening with B1617. But what I showed you is some hints that I think indicate that probably the B1617 variant is growing here in Ontario, as well as in Niagara. And it's something that we need to be very careful about.
And just as a follow-up, is that something that just we don't have a particular connection to India per se, but once it's in the province, eventually it finds its way here?
Well, I think, there's quite a bit of connection to India in other parts of Ontario, particularly if you're thinking about Peel region, there's quite a large population of people who are of Indian descent. And so there probably is some travel. There's probably quite a bit of trade that we have with that part of the world as well. There's international students who often come from that part of the world. So I do think that we have quite a few connections where those infections could have been introduced. We know that actually one of our samples from back in March tested positive through the sequencing for B1617 in someone who had traveled to India. So, at least one case has definitely shown up in Niagara for sure, and I suspect there are others.
Thanks.
Okay, thank you again all for coming. If you have any further questions, don't hesitate to email Meredith, Carrie, or I, and we can help get those answers for you. And we'll see you next week.